These videos were created for you to watch along. They'll teach you about client tracks so you know what's going on. So best of luck with all of your data. Now here's your HMIS system administrator.
Hi everyone. In this section we're going to highlight the additional assessments and key pieces of data collection for different federal partner projects. These are federal partners that require unique assessments for data collection requirements. So the first one we're going to touch on is SSVF. So here you see this client has an enrollment in an SSVF prevention project. For SSVF, the project start date is typically the date of first service when you first start serving them. Some special assessments we want to make sure that you have are going to be the HP targeting criteria, the HP assessment, the homeless prevention assessment for SSVF. So this is the assessment here that gives additional criteria for any type of prioritization. You also want to make sure same as last year, education is collected, that you have veterans information. However, this year that veterans assessment is going to look just a little bit different. So this is the veteran details you want to make sure you have filled out to give information on when they served and if they served in any theaters of operation. New this year, you'll need to collect SOAR status. So here, just whether or not the client is connected with SOAR. And then on the Universal Data Assessment, where we're used to input, manually key in the VAMC station number, that's now a drop-down. One reminder for SSVF is that the VA does want to know what type of services you're providing this veteran, so especially for temporary financial assistance. So that's where we'll log it in services. You should all have an SSVF grant, and you should have SSVF prefix services for all the different reporting criteria. So that way, when you're logging these, it's going into your monthly uploads to tell the VA how you're serving this client. Next, we'll look at RRI. So here we have RRI Basic Center Program or BCP Prevention Project. For every BCP grant that you have, you should see an emergency shelter and a prevention project for your different enrollments. Same as last year, you'll want to make sure you have that BCP status. You'll be collecting employment, health, system utilization, so whether or not they're a former ward of the juvenile justice or child welfare systems. You have a new assessment this year. For BCP projects, you'll have to collect non-cash benefits. That's collected on the financial assessment form here. So if it's just funded by BCP, you'll see the financial assessment and you'll see just non-cash benefits being asked. One of the bigger changes for RRI is the switch of, is actually on the exit side. So you have several that switch collection stages. So R15 and R16 commercial sexual and labor exploitation switched from being asked at entry to being asked at exit. And so here you'll have the RRI exit assessment that has those as well as project completion status. You have some new assessments, counseling assessment, safe and appropriate exit. Here, just whether or not the client received counseling, if yes, how, number of sessions. And then safe and appropriate exit. I added this one in manually. It's not required for BCP prevention, but caseworker should answer the questions whether or not there were connections for the client. And then something that's new for a data collection stage as well as an assessment is the RRI Aftercare Assessment. So the client must be exited because it's supposed to be collected after they've left your project. You'll launch that from the enrollment action menu. So here we see RRI Aftercare. Do we want to add one? So the information was collected. You want to make sure that it's dated within 180 days after the project exit date, because that's what makes it valid. And then you're answering whether or not aftercare is provided, so there's some type of follow-up. And if you did, how is that follow-up provided. In RRI this year, referrals are no longer required to be logged. So that setup data is still available to you. We didn't turn it off. So for your internal reporting or internal data collection, you want to track how many times and where you're referring someone and what referrals you're providing, that's still available to you. Same thing with services. Your old service lists are still available in case you want to continue to log those. But for federal ones that apply to your project, you want to check the RRI manuals to make sure you're logging what HHS is expecting. For PATH, you should always have a services only and a street outreach project. And that which project you enroll a client in is based on where you first encounter them. If you first encounter them in a camp or outside in their car, they're going into a street outreach project. If you have an office in an emergency shelter and you're meeting residents there, the first time you encounter them is in that shelter, they're staying there, that would be services only project enrollment. Once you enroll them, they always stay that enrollment. You don't have to worry about exiting and switching them back and forth if they move between shelter and a camp or not. PATH has some extra dates that we have to pay attention to. So for PATH, the project start date is the date of first contact. So I'm telling the system that I saw them on the 1st of October. Date of engagement is the date of a deliberate client assessment. So that's the client and I sat down on the 2nd to see if they're really eligible for PATH. It could also be the date that they agreed to sign on to a case plan. The date PATH status determined, that's when I know whether or not they qualify for the federal PATH program. And if they do qualify and they're enrolled, that becomes client became enrolled in PATH, yes. And this date PATH status determined becomes the date of federal PATH program enrollment. So especially in federal webinars, if you hear about the enrollment date for PATH specifically, they're looking at this date PATH status determined date where the client became enrolled as yes. The main special assessment you want to collect here is for SOAR status, and again, it's just whether or not this client is connected with SOAR. To make sure you're logging this client as active, you want to continue to log contacts. So every time you see them, so even if it's just you encounter them in the camp, you give a hygiene kit, you have some type of follow-up conversation, that's a contact. You want to make sure you're logging that. PATH, you do still have PATH referrals and PATH services that you'll need to log. And those will count after they are marked as enrolled in the federal program. But those are still available for you, same as prior year's data standards. Last is HOPWA. So the special assessments for HOPWA are going to be your medical assistance and your T-cell and viral load count assessments. Both of these will only show up in a workflow if the client is identified as having HIV/AIDS. So if you're enrolling someone in a HOPWA project and you're not entering in T-cell viral load counts, so you're not answering whether or not they're receiving any type of medical assistance, that likely means that you have not identified the client as having HIV/AIDS. So double check there. Additional assessments you'll see in the workflow. There are some household criteria that we have, at least for the reporting side, to make sure they're reported out in the right AMI category. You'll see a family account information form, which basically is asking for the main address, and what we're looking for is the zip code of the household, and the AMI financial evaluation, which is where we'll look at determining the AMI percentage for the household. And again, that all ties in with the HOPWA APR that's in the system. It's a little bit outside of the data standards, but that's the way to make sure that the HOPWA report will report out accurately. So to recap, some of the special cases we looked at were SSVF prevention, and for SSVF, we're making sure we have that veteran details form filled out. We're doing SOAR collection. We're doing the HP assessment for the prevention side. BCP, we're making sure that You have whether or not they're eligible for RRH services answered. You have the additional exit assessments for counseling, safe and appropriate exit. You have the Aftercare Assessment. You're also making sure that on the RRH exit, you're putting in the R15 and R16 data, commercial and sexual labor exploitation. You have RRH services that you're logging, no longer logging RRH referrals if you're just doing bare minimum. For PATH, key thing are those dates. Project start date is a date of first contact. Date determination, if they became enrolled in PATH, that's the federal program enrollment date. And again, we're logging contacts every time we have that encounter. We're logging those PATH-funded services afterwards, after they're federally enrolled, to keep track of that for the PATH APR. And for HOPWA, the key thing to remember is to make sure that your clients are marked appropriately on the barriers and special needs to identify that they have HIV/AIDS, so that way the HOPWA specific assessments come up in the workflows. All right, thank you, everyone.